At the time, with my medical background, although I knew the signs and symptoms of a heart attack, because I was only 31 at the time, and I had just had a baby, so I was celebrating life, I had no idea that it was a heart attack that was happening. When I was pregnant, a discussion about any heart-related issues was never discussed. I had no idea about the risks afterwards. Women need to be confident and know themselves so that they can advocate for themselves. The type of heart attack that I had wasn't standard, so I had to kind of make my own moves. I had to figure it out for myself, and it's because I did that that I'm here today. I survived for a reason, so I'm going to take every single opportunity that I have to live.
Hi, my name is Dr. Natalie Burley, and I'll be talking to you today about maternal health, keeping moms-to-be and new moms safe and healthy. So some topics to know before getting pregnant and what's important for you to understand and medical risk of becoming pregnant. To talk to your healthcare team about whether you have any signs of heart disease, your family health history, your blood pressure, whether you should lose or gain weight, getting physical activity, those 150 minutes per week that we recommend, eating healthy, sodium in your diet, whether you need to lower your sodium, especially for your blood pressure, prenatal vitamins are recommended, and then quitting any unhealthy habits, including tobacco, alcohol, marijuana, and then having a safe home environment. During pregnancy, you may consider visiting your healthcare provider regularly, in fact, it's recommended, taking your medications as prescribed, reducing stress and anxiety, monitoring your weight gain, once again, avoiding those unhealthy habits that we've talked about, and then following extra precautions if you're older than 35. And we'll talk about why 35 for the specific age later in the talk. In and around delivery, watch for changes that you may be going into labor and take action. If you have concerns about your health or health of your baby, consult your healthcare provider immediately. Some complications shows up days after delivery as well. Your heart rate and blood pressure normally decrease within 48 hours after having your baby. And your blood pressure may increase 3 to 6 days later due to fluid shifts after having your baby. And this should be monitored for complications. After delivery, once again, make your health priority in addition to your baby's health. Continue to get your medical care. Inform new healthcare providers about your pregnancy. Monitor your mental health, especially after you deliver a baby. You have significant changes in your hormones, and so baby blues or even postpartum depression can occur. Find ways to be active. Find time to sleep as much as you can with that new baby, eating nutritious, and then relying on your support network, which will most likely that support network help you with sleeping and eating healthy as well. Warning signs for you to seek medical care right away during your pregnancy include severe or worsening headache, blurred vision or vision changes, feeling dizzy, faint, or disoriented, having a fever, with a fever being 100.4 degrees Fahrenheit or more, weakness or fatigue, vaginal bleeding or foul discharge, abdominal pain, chest pain or racing heart, rapid or labored breathing, nausea, vomiting, unusual swelling of your hands and feet, redness, pain, or swelling in your arms or legs, a slowing or stopping of fetal movement, severe anxiety or depression, thoughts of harming yourself or your child, or general feeling ill. Now some information about maternal death in the US and risk factors for maternal death in the US. So causes of pregnancy-related death is multifactorial. Cardiomyopathy, or the heart pump functioning not well, is one reason. High blood pressure, stroke, other cardiovascular conditions, infection, hemorrhage or bleeding, and then other unknown causes. So 4 key risk factors for maternal death include age. As you can see, under 25 and 25 to 39, Those age demographics are pretty close, being 10.6% and 16.6%, but we have a sharp increase in maternal death once you're 40 years and older. Race and ethnic disparities also play a part in maternal death, as you can see the highest being among Black women. High blood pressure, and this is one that is also a modifiable risk factor, so it's very important to keep in mind in terms of your chronic hypertension. And there's two associated hypertensive syndromes that we have during pregnancy. One is preeclampsia, which is high blood pressure with signs of problems in your organs, such as your kidneys or liver. And eclampsia is essentially going from preeclampsia and then having events of new onset seizures. And these are all related to that first warning sign, sometimes of high blood pressure. Another modifiable risk factor is your obesity. And this is one that we kind of talked about before in terms of before becoming pregnant, whether or not we should consider losing weight before becoming pregnant, and also how much weight you should gain during your pregnancy is a modifiable risk factor as well. Severe obesity, having a body mass index of 40 or higher, increases your risk of maternal death. Thank you for taking your time to attend this seminar and review risk factors and modifiable risk factors for maternal health during pregnancy. Again, this is Dr. Burley, and thank you for your time and attention.
I'm Shannon Hilaire. I live in Papillion, Nebraska with my husband of 5 years and our almost 2-year-old Holiday. She's a lot of fun. For my regular job, I work for the American Heart Association. I'm their communications director for the state of Nebraska. What I do normally is I get to work with survivors of heart disease and stroke and work with them to tell their stories. It's a little different for me.
She's a very personable person, somebody who's really fun and easy to get along with. She cares a lot about others. She's just a really good person to share your life with.
Shannon, she lights up a room. Like, she takes time to notice people for who they are. She just has a way of making you feel like you're the only one in the room and yet entertaining the whole room at the same time.
Working for the American Heart Association, every headache, every heartburn, everything is a stroke, is a heart attack in your head. When I went in for our 20-week ultrasound with our daughter, I kept asking about congenital heart defects too, to the point where they were like, do you have this in your history? I said, no, it's an occupational hazard. It's where we work. You hear about it so much that you're a little bit more aware of it. And I didn't think it would hit home as quickly as it did. With your first pregnancy, you don't have a frame of reference, and Google can be really scary. It was really early on. Lots of throwing up, which a lot of women deal with. A lot of migraines, which I'd had before. Bloody noses. I have had severe carpal tunnel from like my fingertips up to my arms. And it was that way throughout pregnancy. I kind of just put a stamp on it like, this is pregnancy. It just sucks. Let's just deal with it. I was working all weekend. I was filming stories like this one, 2 in a row, back to back, the weekend of Easter. And I remember waking up and being so swollen that I literally needed my husband's assistance in like changing because the clothes didn't fit. And I thought, 8 months pregnant. And I had trouble seeing and was really woozy, and my head hurt really bad. And again, 8 months pregnant. That's what I figured it was. Had an appointment on Monday. I'd bring it up then. So come Easter, felt really anxious. Nothing fit. I didn't want to go because I didn't feel good.
They were late, and Shannon is never late on a holiday. She always gets like right in the middle of everyone because she's a conversationalist, and she kind of sat at the end of the table, which I thought was odd, and then she was very quiet, and I was watching her, and she was kind of pushing things around on her plate, and I asked her, how are you doing? And she said, just another headache, Mom.
So we had dinner, and my oldest brother told me, hey sis, your feet look really fat. I was like, thanks. I didn't say something nice back, but I thought about it for a few minutes, like, you're right. And my rubber wedding ring that I was wearing didn't fit. And my mom was an OB nurse for more than 20 years, I think. And I asked her, isn't that a sign of preeclampsia?
I asked her numerous times about her blood pressure. In fact, Shannon had told me, no, my blood pressure is doing really well. Look at this. But I felt there was something wrong.
We started to go to bed, and then I remembered again. I was like, I still don't feel right. Maybe we should take my blood pressure. And we did, and it hurt to take it. A healthy reading's like 120/70. Well, my top number was close to 200, and my bottom was well over 100.
They called and told me what her blood pressure was. They had already told me they had taken it a second time, and I said, then I think you should go.
Then we got to the hospital and went to the door and used the intercom, and my husband was like, my wife's blood pressure is a little high, and I said the numbers, and it was the same thing. Come straight up.
The doctors, immediately got her into a bed and checked her blood pressure. And then at that time, I could kind of tell it was serious.
There were so many people that swarmed me all at once. And the numbers just kept creeping up. And the top number got as high as 212. The only way at this point to make the numbers better was to deliver. But my numbers were so high it wasn't safe to C-section.
Things weren't going as well as they'd liked, and they were going to push her a little bit harder. And so they wanted to put in an epidural, and I knew the stress that was going to put on her body.
The epidural made my numbers plummet really fast. And so I do remember falling forward to my mom.
And she just went very white and non-responsive. If her blood pressure is going down, the baby is not getting circulated and is not getting oxygen. And so, holding her unconscious in my hands and listening to baby's heart rate drop, very difficult. I knew we'd bring Shannon back. I just didn't know if we'd bring the baby, how the baby was going to pull through all of that.
And I remember they said, it's time to push. I asked my husband for a hairbrush and a ponytail holder, because first impressions matter. And I was ready. This was my, I can do this. Hair up in a ponytail. Let's get this done.
I always knew that Shannon had a lot of strength, that she was a really strong individual, but just to see that was, it made me, fall in love with her even more.
She was only 4 pounds, 15 ounces, really tiny. She was swarmed by doctors, and she wasn't crying either. She was purple and little and no tears. She finally cried, and it just turned out that it took a little bit of time with her lungs.
She's a fighter just like her mommy, so.
A special moment that I'll never, obviously forget.
Health-wise, it took a bit. She was not on the growth curve like the traditional, everyone tells you my kid's this percentile. She wasn't even on that until she was almost a year. She had her own curve, and I think that kind of plays into her personality. I'm going to do it my own way.
She's a very curious kid and a very adventurous kid, and I really enjoy seeing her try to navigate the world. Her curiosity and willingness to learn and explore is something that is really inspiring to me.
I've always liked having something to look forward to, something to plan for, to decorate for, even the tiniest of celebration. I'm there and have a themed outfit for, and she was something I looked forward to my entire life, and she's something that's worth celebrating every day. So that's how we got her name. Her name is Holiday. They warn you a lot in your pre-appointments about preeclampsia. Usually it's, they're taking your blood pressure, they're taking your weight. When they finally told me what was going on, I felt like the mom guilt already. Did I do something to caused this? Why didn't I listen to my body earlier? I felt terrible all weekend. And one of the nurses had said something to me that resonates. If I had gone to bed that night, neither one of us would have made it. That hits really hard, and that's really scary to think about. If I had done something just a little bit differently, what that could have meant for us, for my husband, and all of us. So what scares me now, and being in the position that I'm in, to be aware of all of this data and all of this science and all this background, is when you have preeclampsia and you have high blood pressure during pregnancy, you have so much more likelihood of having it later on in life too, and continuing to have high blood pressure. Another thing that's really tough for me is the range of possibility of having preeclampsia issues in another pregnancy is pretty high. And so that makes me very nervous about even considering doing it again.
Yeah, I'm just grateful for the safety of my wife and my daughter. Out of all of this, that we got a beautiful gift of holiday. She's, brought so much love and joy to our world. I'm just really happy that we're able to have a wonderful family moving forward.
I think if you're pregnant or not, you should have a blood pressure cuff at home. It's really important to know what your number should be and to keep track of it, whether you're at high risk or not, because you might be and you don't even know it. And work with your doctor to understand what your number should be and what's normal and how you should feel.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your 2 measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, Visit the website.
After the birth of my daughter, which was in 2019 in August, that's when I had my first episode, and I stayed in the cardiologist. They let me know that I had cardiomyopathy, which is the enlargement of the heart. I had never heard about cardiomyopathy. Before my diagnosis, I never knew that that could happen to a woman my age. After the diagnosis, I felt like I was a failure. Maybe that it was me that did something wrong. Now that I know that anything can happen while we're pregnant at any age, I would tell any of my family members, friends, to always speak up. I live years by now taking care of myself in order for my children to know in the future that their mom is a warrior, their mom is a survivor.
I want to welcome everybody today to the American Heart Association, and we want to help women to be healthy during pregnancy, after pregnancy, and going forward. I'm an integrative cardiologist. My name is Alicia Williams, and I had a pleasure to work with both Borges Ascension Health, and I'm now also working in integrative cardiology. So this topic is very special to me. We're going to go through some really important things because we all know how much COVID helped us. It helped us to be very unhealthy, unfortunately. Even though some people made some good changes, we picked up some really bad habits. We picked up some extra weight, and our risk factors are not as well controlled. So now it's really important that we get back on track with our health. The biggest thing that we're really worried about right now is our mental health. I think most of the patients that I talk to are so stressed. And this has been especially evident for women because you're dealing a lot with children, with work, and all the other things that make us stressed. And of course, we look at things like disparity in healthcare with minorities and also in urban settings where we can't always control our health surroundings. It's really important to reach out and get help for mental health. It impacts us so greatly. Our heart health is directly linked to our mental health. And when we have chronic mental health conditions, it astronomically increases the risk of all sorts of illnesses, but especially cardiovascular risk, and it's all ages. It's not just older people, it's younger people too. And really, when we look at people that think they're healthy, we're not really that healthy. We need to reach out. We need to get help. We need to learn how to take care of ourselves. It's really critical. And so what can we do? A lot of times we feel overwhelmed. And the American Heart Association, if we look at the basics, tobacco, moving, eating healthy, keeping our weight healthy, the blood pressure and the blood sugar and our cholesterol, if you can tackle one of those at a time, you're making a huge difference in your health. And we know these things work. And unfortunately, very few people are able to handle even getting a few risk factors under control, but it really shouldn't be that difficult. If we look at risk factors and how much that they can impact our health, it isn't just making us feel better. It's making an impact on heart disease, stroke, cancer, our brain, And also, our disability is overwhelming. We have to be healthy so that we can work and be strong and take care of our families. When you look at eating, it doesn't have to be difficult. It's hard being sick. It's not hard eating healthy. I tell people that if you can just boost your fruits and vegetables, boost your fiber, and when you look at grains, you want to get them as close as possible to where they came out of the ground. If you look at healthy proteins like fish, avoiding salt and sugar, a lot of times it's going back to whole foods. And you can do this, but you just need help. So the American Heart has some good resources to learn how to eat healthy. When you want to get active, sometimes it seems overwhelming. One of the tips that I tell people is, why don't you, right after you eat, go out and walk 5 minutes out and walk 5 minutes back. That shows that that can help with controlling blood sugar after you eat. But you have to build and you have to move each part of the day so that you build up minutes of activity. And it can be little increments at a time. Get a health tracker if you can. And when you look at your weight, you really want to look at, what am I dealing with? Do some measurements, get some information about your BMI, look at your waist circumference, because that is going to make you aware that that's your starting point. And then whatever diet you choose, and there's some good options, it doesn't have to be rigid, but you have to keep moving towards a healthier diet. More fiber, more fresh vegetables and fruit if you can get them, or frozen, and just try to eat foods as close as what they came out of the ground. Your cholesterol, if you do some of those things, will move along in the right direction. When we get rid of our processed foods, we get rid of sugar, we get rid of salt. When you look at how often you snack, or whether you're eating constantly during the day, you don't really need that many calories. So when you try some healthier snacks, or just more pauses in between eating, and then looking at the good fats that you can get in that help make you feel full, and the fiber that will help the cholesterol. Sometimes people need help, but you can usually help it with foods. And the same thing with blood sugar. We are overeating all the time. We know that some compressed eating can help blood sugar. This is something you need to get help with. But when we look at how much we eat with each meal, it doesn't make sense for our blood sugar control. Also, we're getting too many processed sugars and carbs. So let's learn how to track our blood sugar, and let's do all the things that we talked about: moving, eating well, and then also really looking at what is our healthy weight and making some goals. Your blood pressure is critical. This is especially important not only during pregnancy, but after pregnancy. Women that have had high blood pressure during pregnancy or high blood sugar are at a much higher risk later in life for having heart disease. So let's start learning how to check our blood pressure. And if you're able to get a blood pressure cuff, that's great. But it's really important to know your numbers. Smoking is so unfortunate that we still have to deal with this, but we have to be realistic. Smoking is never going to be healthy. Vaping is not going to help. Chewing tobacco is not going to help. 2 cigarettes a day make an astronomical increased risk in heart disease in women. Not 2 packs, 2 cigarettes. So you really need to reach out, get some help, and quit. Fighting stress is really important. You have got to find some time whenever you can to take little mini breaks and to make priorities so that you have some time for yourself. That might mean quiet time. It might mean not signing up for everything that you want to do. And it might mean sharing time with someone that can help you and you can help them. This is really critical. I want to thank you for joining American Heart today. They really want you to stay healthy. We want you to reach out and get resources so that you can learn how to be happy and healthy, not only during pregnancy and childbearing years, but all of the years in the future, so you can stay away from heart disease. And it was so nice spending time with you today. Thank you.
I don't remember life without Isaiah.
I remember when she found out she was pregnant, she called a family meeting. After Isaiah was born, Nisha was really sick. She was hospitalized several times.
All I knew is that I felt like I was gonna die. We went immediately to the hospital and they did an echo and they told me that my heart worked at 25%. It looks like heart failure. I guess I didn't know what it meant for me or for my child.
I didn't know anything about her disease, I think peripartum cardiomyopathy. I never knew that young people were affected by it until it happened to her.
As a new mother, I was 23 years old when I was diagnosed, and I had a brand new baby, so I didn't really know what I was doing. And I felt pretty good for some years until about 2016, I had a stroke.
When I noticed something was wrong with her, I started crying.
I just remember that I couldn't speak. And from a lot of the people that I've seen that had experienced strokes, I was worried about how was I going to be able to care for Isaiah.
Denisha had a second stroke at the emergency room. It meant she was running out of time. They sent her to a specialist in Oklahoma City. We were hoping she would get a heart while she was there, but instead, she came home with an LVAD, which is a machine that helps to keep your heart beating. The LVAD ran on batteries, which was scary, but it was her lifeline. It kept her heart going for almost a year. Then, on September 25th, 2017,
that night, Isaiah and I were gonna go to bed, and I got a call from Oklahoma City, and they told me, well, we've accepted a heart on your behalf.
when the call came, Isaiah called me immediately and said, "My mom got a heart." And I said, "You're kidding." And he said, "No, she's on the phone crying right now."
I always knew I was gonna get the heart because I had to be here for Isaiah. I was nervous. I was scared because as a mother, I knew that this could be the last time that I saw him, that I smelled him. We just went down and I told him, "I'll see you when I get back."
When I first heard her new heart beating, it was so strong and so powerful. I was just like, wow, and I knew that the heart was from a teenager.
When the doctor explained to me that I needed a transplant, my thought was somebody would have to give their life for me to live. And I just pray that I live in a way that would be pleasing to her, that would make her proud, to say she's powered by me, But I'm just extremely grateful for that gift.
And I also, think it's very important that, research continue because not everybody gets to make it home. So there's research that's needed and funding that's still needed so that people can return home to their families and live a successful life.
We all need to be educated to know the signs and the symptoms to look for. If we don't know, then there's just going to be more people and more families that can be destroyed by this disease. So I would say just give and donate so everybody can know and be aware.
Dear donor family, my name is Denisha, and I am the recipient of your loved one's heart. The words thank you cannot express the appreciation that I feel for the gift of life my donor has given me. I also want to express my heartfelt sympathy for the loss of your loved one. I'm a single mother of a 9-year-old son. 1 year ago, I was questioning how much time I had left with my son and making arrangements as to who would care for him in my absence. I had suffered from congestive heart failure since his birth. He had never known me to be healthy. Since the transplant, your gift beats strongly inside my chest. Not a day goes by without me being deeply grateful for a second chance at life. I look forward to each day with my son, and I look forward to the future and hope to live in a way that will make my donor proud. Thank you from the bottom of my heart, a grateful recipient.
Hi, everyone. My name is Logan Pulley. I am the Development Director for the American Heart Association in Kalamazoo in West Michigan. So I just wanted to come and say thank you for everybody being here. And I wanted to do a special thank you for all of our presenters today, especially Dr. Burley and Dr. Williams. It means a lot that they were able to take the time to help educate our community on this very important topic. It's especially valuable for all of us to be here learning about this topic because cardiovascular disease is the leading cause of maternal death. This means that heart disease is the #1 killer of new moms. We are also super grateful that we have Ascension Borges as our presenting sponsor for Go Red for Women here in Kalamazoo, and that they've been able to help us put on this wonderful webinar. So thank you all for being here again and taking the time to learn and educate yourselves, as well as be able to take this information out into the community. Our next webinar is coming up on July 13th, sponsored by Bell's Brewery, and we will be doing our Go Red talks, focusing on how to get out and be active from women that are doing just that right here in Southwest Michigan. So thank you all again, and we hope to see you on July 13th, and I hope you all have a great weekend.